Hello students, welcome back to our channel. In today's topic we are going to discuss about the leprosy, which is otherwise called as Hansen's disease. Definition: leprosy is a chronic infectious disease caused by Mycobacterium leprae, primarily affecting the skin, peripheral nerve, mucosa of the upper respiratory tract and eyes. If left untreated, it leads to nerve damage, deformities and disability. Incidence and the mode of transmission: it's just a bacterium disease, which is Mycobacterium leprae, but which causes that severe illness in patients. Incidence: leprosy is endemic in several countries, with India accounting for over 50% of global cases. Affects all age groups, with more prevalence among the low socio-economic group because of poor hygiene. Mode of transmission: transmitted via respiratory droplets from untreated multibacillar cases. Requires prolonged close contact. Incubation period 2 to 20 years, average 5 years. So no one can diagnose unless or until if it's diagnosed. Of it can be incubated from 2 years to 20 years, average of 5 years we can see the symptoms. So clinical features: advanced affected, system affected, and the features. If the system skin, if it's the dermal layer, then the feature will be hypopigmented or reddish patches with a loss of sensation, nodules, dry or the scaly skin. If the nervous system is affected, then the features are the thickened peripheral nerves, sensory loss, glow and stalking, muscle weakness or paralysis are seen. If it's eye, then the langothalamus incomplete, eyelids closure, corneal ulceration. If it's muscle, atrophy of intrinsic muscle, hand muscles will be present. And if it's other system affected, recurrent injuries, ulcers, deformities due to sensory motor loss. Next is common deformities in leprosy. Hand deform if it's common deformities and its causes: claw hand, paralysis of ulnar and median nerve involvement. If it's foot drop, common peroneal nerve involvement. If it's wrist drop, radial nerve palsy. If it's lagothalmos, then it's facial nerve palsy, lagothalmos. Then it's nasal collapse, then the destruction of nasal cartilage will be seen. If it's plantar ulcers, sensory loss and feet leading to repeated trauma. Medical management: multi-drug therapy, MDT, as per WHO. Pacubacillary, PB, it's rifampicin, dapsone 3 months. If it's multibacillary, rifampicin plus dapsone plus clofamzimine for 12 months. Corticosteroids for neuritis or leprosy reactions. Thalidomide in type 2 leprosy reaction, ENL. Early diagnosis and completion of MDT can prevent disability. Tendon transfer operations performed to restore the function in patients with irreversible paralysis or the deformities. Example of the deformity and the suggested tendon transfer surgery. If it's claw hand, modified branch transfer, FDS, or the ECRL to lateral bands. Foot drop, tibialis posterior transferred to dorsum of foot. Lagothalmos, temporalis muscle transferred to eyelid. Wrist drop, pronator teres to ECRB transfer. Physiotherapy management: before tendon transfer, after tendon transfer. If it's before tendon transfer, maintain joint range of motion, strengthen non-paralyzed muscle, splinting to prevent contractures. Sensory re-education, skin and ulcer care. If it's after tendon transfer, then physiotherapy care should be of immobilization of the limb for 3 to 4 weeks. Progressive mobilization and splinting should be done. Muscle re-education exercises and functional training and ADL retraining. Monitor for complications or graft failure. Anesthetic limbs, risk and care. The risk is loss of protective sensation, high risk of cuts, burns, ulcers or infections. Repeated unnoticed trauma, deformities leads to chronic ulcerations. Care measures: daily inspection and hygiene, use of protective footwear, avoid walking barefoot or carrying hot objects, avoid prolonged pressure on specific points, skin moisturization, callus removal. For plantar ulcer in leprosy, the causes are the loss of sensation, muscle imbalance, repeated trauma, pressure point, especially metatarsal head and heel. So the management and in management, what are the approaches and what is the description? So the approach is rest and offloading. Description: total contact casting, TCC, orthotic shoes. Wound care: debridement, antiseptic dressing. Footwear: custom made MRC footwear, rocker bottom soles, soft insoles. Physiotherapy: gait training, pressure relief technique, ankle mobility. Education: foot hygiene, daily inspection, and also shoe check. So let's summarize the session. The definition of Hansen's disease is chronic disease caused by Mycobacterium leprae. Transmission: airborne droplet, prolonged contact. Clinical signs and symptoms: skin lesions, nerve thickening, and sensory loss. Deformities: common deformities in the major stages are claw hand, foot drop, facial paralysis. And major treatment will be MDT, WHO recommended, corticosteroids for reaction. Tendon transfer in further cases restores lost function. Physiotherapy role: pre and post operative care, prevent deformities, educate patient. Anesthetic limb care, protective footwear, daily inspection, plantar ulceration. Offloading, wound care, orthotic footwear. Hope you guys have learned something new today. Happy learning. Stay tuned.